Hi, everybody. Welcome back to the second lecture of the winter school, or day two of the winter school, and the sort of lecture that will wrap up day two. Today we will have Dr. Daniel Stockemer presenting his research entitled "Contagious Politics and COVID-19: Does infectious disease hit populist supporters harder?" I'll be co-chairing the session along with, and my name is Ammar Shamaileh. I'll be co-chairing the session with Abdelkarim Menge. Dr. Daniel Stockemer is the Konrad Adenauer Research Chair in Empirical Democracy Studies and full professor in the School of Political Studies at the University of Ottawa, Canada. His main research interests are political participation, political representation, and populism. Since becoming a professor in 2010, Dr. Stockemer has published 4 individually authored books, 1 edited volume, 1 textbook, and more than 130 articles in peer-reviewed journals. Dr. Stockemer is also the editor of the Springer book series in electoral politics, and since autumn 2019, he's the editor of the International Political Science Review. It's a great honor to have him here with us, at least virtually, at the Winter School and participating in this great event. And so I'm sure he looks forward to your fantastic questions after his presentation, and I'm greatly looking forward to his presentation and your questions as well. Dr. Stockemer, if you'd like to begin.
Thank you so much, Sherman, and yeah, thanks for having me. Yeah, when I saw that there's actually a room full of people, or at least some people, I got a little jealous. I've been at the last conference more than 2 years ago. I also want to apologize for not being able to be with you in presence, but in Ottawa or in Canada, we have again a lockdown. So the COVID situation looks pretty bad, and we have an official travel advisory not to go abroad. So yeah, this stops all ideas to go abroad. But yeah, I want to really thank you for having me, and hopefully I can come and visit you and also see Doha and in Qatar, maybe next year or maybe another time. So I'm looking forward to that. Without further ado, I'm now sharing my screen and present you. That's ongoing research, I have to say. But since I asked the organizers a couple of times, what should I present? They always said, present what you feel the most comfortable with. So I thought I'd share some really new research with you, which I write with some people in Germany. So the title of my presentation is Contagious Politics and COVID-19: Does the infectious disease hit populist supporters harder? And I start off with a quote from the president of the case we are studying, Brazil. And it's a quote on COVID by Bolsonaro. And he said relatively early on in the pandemic, in my opinion, it is much more a fantasy, this question of the coronavirus, which is not all that big deal the big media speaks about or propagates around the world. And so more generally, Bolsonaro is part of a group of populist leaders, including Donald Trump or Lukashenko, who, at least for some time, have belittled what would become the largest pandemic in the 21st century. And in this presentation, it is my goal to show that the populist anti-science and belittling behavior of COVID-19 can have dire consequences that can go as far as life and death for citizens. I want to start off the presentation by reminding you, you're probably all familiar, but by reminding you some features of the populist leader. So the populist leader is normally a polarizing figure. He or she adheres to the notion of strong leadership. A recent article in Political Studies calls the populist leader self-definition the superhero. Very important, he or she bifurcates the world into 2 opposite camps: the virtuous people versus the corrupted enemies or corrupted elites. And he or she uses a simple, emotional, polarized, and negative us versus them rhetoric that really divides the world in 2 opposite camps. And very relevant to the topic of my talk, he or she takes an anti-science stance. And so if we compare populist leadership and effective crisis management, and this goes back, this idea of effective crisis management or the type of studies I prefer to go back to Boyne. We will see if we compare populist leadership and effective crisis management that there are big contradictions. For example, one aspect of effective crisis management would be reliance on scientific evidence. In contrast, populist leadership style is based on anti-science. Populists reject all elites of the system, and scientific elites are part of this broader elite they reject. Another aspect of effective crisis management is the necessity to engage in a multi-organizational, polycentric response network to make decisions in an environment of uncertainty. And this also involves a lot of collaboration between different actors. Populist leadership style normally is based on top-down decision-making. On top is the populist, and he or she makes decisions basically on his personal whim. Another feature of populist leadership style is outpacing and destruction of competitors is of higher priority than strategic contingency planning. And what I think is that the crisis can be applied to populist self-definitions as the savior of the common people. Further, effective crisis management necessitates the narration of a persuading story about the crisis and its origin with a view to mobilizing the collective crisis management efforts of the public. This requires communication that builds a sense of we rather than me and brings citizens together. Again, this is in contradiction to the general populist leadership style, which is normally based on the dichotomy between friends and foe. And the idea is to polarize the world rather than unite it. And normally populists express more what they dislike than what they like. And so altogether, there's already a theoretical contradiction between, on the one hand, effective crisis management, and on the other hand, what we generally refer to as the populist leadership style. If we look at Bolsonaro, there are many, many examples that during the crisis, rather than engaging in effective crisis management, he has rather followed this ideal of a populist leadership style. For example, he has engaged in a denial strategy. In the height of the first wave, for example, Bolsonaro explained that the coronavirus was a fantasy inflated by the media, that there was no reason to panic, and the disease was a measly cold, and he urged that people should go back to normal and should especially continue to work and live a normal life. He openly attacked governors and mayors for putting in place any type of crisis containment measures, such as social distancing protocols, or in some places, lockdowns. Bolsonaro participated in many street demonstrations against the corona measures. On these occasions, he has normally not worn face masks, he shook hands with his supporters, and he ignored all social distancing measures. Similar to Trump, he has repeatedly pushed for the use of chloroquine to treat COVID-19 patients, despite the lack of any scientific evidence about its efficacy. And he also connected corona with some homophobic tone or style. For example, he associated the feeling of fear and protective measures as COVID-19 to queerness in a pejorative and homophobic tone. And finally, he commented on the possible side effects of vaccines, that if people take the vaccine, they might become crocodiles. So what we assume in this research is that these actions have some consequences, in particularly in a polarized society like Brazil. What happens in a polarized society? Normally, supporters tend to rely on leaders' cues. They try to trust information they receive from whoever camp they are. And this could lead supporters to believe false information. And in the literature, we label this confirmation bias. And anyone locked in such an information cascade or a mindset might draw inferences from small circles of people, and in particular their trusted leader, and consider them representative and true, even if they are not. So what this might imply for the behavior of populist supporters, this might imply that these people who suffer from belief polarization might not realize or might not want to realize the severity of the crisis. And of course, this should have repercussions on how they behave. So this brings up to my theoretical model. So first, the populist signals that COVID-19 is not a serious threat. Hence, followers believe in this misinformation and refrain from disease mitigating behavior more than, let's say, other people. And this will then have consequences for the life and death of people. So, and then we hypothesize that areas with strong populist support are more at risk to see high infection rates and death rates. So again, the populist signals, the followers believe, and then this has impacts on infection rate and death rates at any level. So the hypotheses are, the first hypothesis, compared to opponents, supporters of the populist leaders are more likely to belittle a pandemic such as COVID-19 and defy crisis containment measures such as wearing masks. And the second hypothesis, which follows from the first hypothesis, is that municipalities with more support for the populist leader have higher infection rates and death rates than municipalities with lower support for the populist leader. So the methods to test our first hypothesis, we used an original telephone survey, which is representative of the adult population age 18 and over. We had a number of observations, 2,000. We fielded the survey a little more than a year ago in December 2020 at the height of the second wave. And we have several dependent variables we were interested in: respondents' belief in science, their assessment of the importance of COVID, their fear of catching COVID-19, and their likelihood to wear masks in the public. And as independent variables, we wanted to see whether support for Bolsonaro had any impact on these crisis mitigation measures, or any impact on how severely people thought COVID was, or if they believed in science. And the independent variables were vote for Bolsonaro in 2018 in the first round of presidential elections, or the self-declared vote. And then to have a more contemporary measure, we looked at satisfaction rating with our current satisfaction rating with Bolsonaro at the time we took the survey. We have also some control variables like age, gender, education, religiosity, and race. To test then H2, our second hypothesis, we looked at municipalities. Why municipalities? Because it's the lowest administrative units we can get data for, and it would reduce the risk of ecological fallacies. That means to go at a higher level, the relationship would be less clear. So what we look at is the dependent variable, the number of COVID cases per municipality, and the total number of COVID deaths per municipality. I mean, what's very cool about this study is that we have basically a population. We couldn't get data for one single municipality. So we have data for 5,569 municipalities out of 5,570 that are officially listed in by the Statistics Canada. And our control variables are, again, our independent variables, the vote share for Bolsonaro in the first round of the presidential election 2018, aggregated at the municipal level. And then we have control variables, population density, education, affluence of the municipality, and the share of the elderly population over 65. And in this model, we also include fixed effects for the state, because the states had completely different crisis mitigation measures in Brazil. So here are some results for H1. And here what I do is, these are some predicted effects of some of the independent variable on the dependent variable. We use as independent variable satisfaction with President Bolsonaro. The first dependent variable response is predicted belief in science. And as we can see, as if we go along the x-axis, values on the y-axis decrease. That means the more satisfied people are with Bolsonaro, the less they believe in science. The second graph, the predicted likelihood or the predicted effect of satisfaction rating with Bolsonaro, respondents believe that COVID is the most important topic Brazil is currently facing. Again, we go along the x-axis, that means higher satisfaction ratings with President Bolsonaro. We see that the likelihood that people think COVID-19 is the most important topic decreases. If we look fears about catching COVID, we also see that the more they're satisfied with Bolsonaro, the less likely they have this fear. And finally, the likelihood of wearing face masks. And if we look, for example, at the blue line, there is still 10 percentage points lower likelihood for Bolsonaro supporters to always wear face masks than for or for people that are satisfied with Bolsonaro than people that are not satisfied. And again, satisfaction with Bolsonaro is like a proxy for Bolsonaro supporters. We assume that those who are very satisfied also support him a lot. So what we find is basically support for our first hypothesis. That means, yes, people that support Bolsonaro are less likely to believe in science, less likely to wear masks, less likely to see COVID as an important disease. And now in the second part of the analysis, we want to know, okay, what are the impacts, basically for real and life, of this behavior? And for this, we did the municipal level study. Here, here is the regression result. If you look at the first row, which is the vote share for Bolsonaro in 2018 at the municipal level, and we find that first there's first model looks at the first two models look at infection rates. The second two models, model 9 and 10, look at death rates, and we find that in the bivariate, so model 7 and model 9, these relationships are significant. In the multivariate, they're also significant. What I did, we just calculated some predicted probabilities, and for example, to give you an idea about the impact, the influence of this effect. So, for example, the predicted effect of the vote share for Bolsonaro on COVID-19 infection rates, they predicted 420 new cases per 100,000 inhabitants for every 10% increase in the president's vote share. So for every 10 points the president had more vote in a municipality, we can expect this municipality to have 420 new cases per 100,000 inhabitants. If we look at the death rates, we can expect that for every 10 percentage points increase in the Bolsonaro vote share, there will be 7 more deaths. So I also have some take-home points from this study. First one is, in a polarized society, leaders' cues and communication impact voters' attitude and behavior. So this, for the whole society, means that partisanship affects individuals' belief in compliance with health measures, and these findings particularly also applies to COVID-19. And so if a populist signals to his or her supporters that a health crisis is not as severe as scientists are telling us, the populist supporters might follow their leader in belittling the crisis and the measures to contain it. This in turn can have dire consequences in the health and well-being of the same supporters. Even if these consequences might not influence the personal well-being of the populist supporters personally, they might nevertheless affect the village, town, or city these supporters live in that these villages and cities have higher infection rates and higher death rates. I'm looking forward to your comments, questions, and discussions. And please feel free to also challenge me if you disagree with everything I said. Thanks a lot for having me, and I'm really looking forward to a nice discussion now.
Thank you very much, Dr. Stockemer. First of all, I thought the presentation was fascinating. I just wanted to note that. And I'd like to start off by handing off the mantle to Dr. Abdulkarim Amenge, who will take questions from the floor as well as from other winter school participants.
Thank you. Thank you very much, Ammar. We'll start like the Q&A questions. Please go ahead.
Thank you very much for the presentation. I found it very interesting. I have a comment and then a question really quickly. So obviously, I think the basic premise that a leader saying undermining the significance of the pandemic would potentially affect the way followers or supporters behaved in such a context makes sense to me. But it would seem to me that there's a question about generalizability. Yes, Trump, Bolsonaro undermine the significance of the virus, but other noted populists, Duterte, Orban, Modi, instituted illiberal complete lockdowns. And so I guess my question is, what is the populist adjective really important here? And can we really generalize across cases? And the reason I bring this up is because it's kind of a bone that I have to pick with a lot of the way that this has been covered in the press, right? We were told at the beginning democracies would respond better to the pandemic than authoritarian regimes. This is a favorite line of political scientists, and yet that hasn't turned out to be true. And so the pivot to populism, right? For me, sometimes it seems like a get out of jail free card. We say, oh, no, there are no underlying deeper problems with liberal democracies. The problem is these crazy populists. And I'm just wondering how you respond to something like that. Because I think as political scientists, we have to be focusing on deeper structural and institutional crises within these liberal democracies, and not necessarily ascribing the failure of the response to populist leaders. Has Boris Johnson done a poor job? Yes. Trump? Yes. Bolsonaro? Yes. Has COVID-19 also exposed deeper underlying failings within all three of these celebrated liberal democracies? I think so as well. Thank you.
Okay, good question. But so let me rephrase this a little bit. So I'm not making any claims about the broader, let's say, response capacity of liberal democracies or non-liberal democracies. What I might come back with you when you bring other examples, like Viktor Orban would be another one, or Duterte, or India, they have basically, or even in Canada, I mean, a little bit, I mean, in Quebec, we had a little bit of a populist party. In Ontario, we have a populist in power. But what I would come back to is that most of these populists basically left their populist credentials. I mean, if we believe the literature, I think how I described it, I might have done it a little too much black and white, but how I describe the literature is ideally how populists even self-describe themselves. And some of them, maybe during a crisis, have just not followed what I label populist credentials. So I think I mean, very stylized. We can maybe discuss this differently and say a populist had a chance at the beginning or at any turning point of the crisis to either adhere to populist credentials, and a lot of populist parties did so. Also, some were not in power. Examples would, for example, be the Alternative for Germany in Germany, or many other radical right-wing parties in Europe, especially those especially those in Western Europe. So I would say, but some populists have just not, at least in this field, just left behind what I labeled this populist mindset or this populist credentials. But I mean, what I completely agree with you, I mean, this populist leadership style is one effect. And I mean, what I look is like a within country effect. I'm not making any claim about whether in general liberal democracies did better or worse than non-liberal democracies. But I mean, the cases I've cited, I mean, the cases like what you said is Trump, Bolsonaro. These are Boris Johnson, if you consider him a populist. I mean, these are cases in liberal democracies where clearly the populist leaders' cues made an impact on people, and probably made an impact on life and death. But of course, this should not take away from failures in other aspects in any country, but also including liberal democracies. Sorry, I was like wobbling around, but I hope I answered a little bit your question.
Thank you very much. I will be back to you. We have like Professor Taggart. Please go ahead, and then you. Okay.
Thank you. Can you hear me, Daniel?
Yes.
I thought it was a really, really elegant paper, because essentially you're arguing how populists kill their supporters. I mean, that's the bottom line. It's a really elegant piece of work. And I just want to I want to challenge you on one thing, not because I think it's really fundamental, because I thought it's really interesting, is your assumption that populists are anti-science. And certainly with the cases that you suggest that they are, and I think probably majority of contemporary populists are anti-science, but it just made me reflect on why would that be? Why would we assume they're anti-science? In fact, and there are counter cases. I can't think of that many, if I'm honest, but the original populists in the US, the People's Party, they were quite technocratic and actually quite scientific in the way that they thought government should run. Now, that doesn't disprove your case. It just makes you think about why would we expect populism to be anti-science? Isn't it more about it's against the establishment and the science is kind of emblematic of the establishment. So I just want to just push you a little bit on whether populism is inherently anti-science.
Oh, that's a good question. I mean, I think in the cases I discussed, especially in Brazil, if you take the US, if you take, I would say even partly the UK, we see this anti-science stance, and I would say, contemporary populism has a strong, as we all know, and strong anti-elitist outlook, and most scientists are part of the elites. We can also see that this also reflects themselves like in anti-academic output. We see this, for example, very strongly in Hungary right now. And so, maybe to rephrase, I don't think they're inherently anti-science. I wouldn't say that's part of the initial definition of populism, but how populism manifests itself contemporarily, I would say there's a very strong anti-science perspective that we can, because the scientists are so, in this bifurcation between good and bad, they're rather put to the bad side because they're also very strongly linked with the establishment. They receive money from the establishment, they work for the establishment. And so I think they make the case. I would say in contemporary cases, we will find it's probably not a necessary condition, but I would say it manifests itself in many programs. Would be an interesting study to look actually in how, take a data set on populist parties and look how many actually are anti-science. I would say it's probably at least 80%.
Yeah. Can I be a bit cheeky and come back and just say, because you're making me think a lot. I just wonder whether what's interesting about the COVID crisis is that there isn't an enemy as such, is there? For most populist things, there's an other, there's somebody to attack. Well, you can't attack the virus. And maybe in this sort of a crisis, in a sense, the other then becomes science. It's a way of creating an enemy where there isn't a natural enemy, and because it is an interesting kind of example of a crisis, well, a crisis without an enemy.
I think that's a very good point. But that would actually reinforce my point by saying that they need to find an enemy, and science might be a good target.
Thank you very much, Daniel. And Paul, please go ahead, Kat.
Yeah, thank you very much for the presentation. It's a very interesting and also very timely addition to the scholarship. So my question is about the perception of populist leaders as competent and effective action-oriented leaders, because a lot of the populist discourse is about getting things done that the traditional political parties can't get done, like draining the swamp and so on, and finally moving the country forward in the direction that the people wanted to go in. So you have this image of competence, which to me would seem to contrast really heavily with this total lack of action and this denial of the pandemic, which sees death rates increasing, hospitalization rates increasing, and a general catastrophic scenario going on. So, do you find that this lack of taking action and letting the pandemic spiral out of control while denying it contrasts with the populist attempts to create an image of themselves as hyper competent, more competent than the traditional political parties? Or do you think that rather that's part of the narrative, that they are able to use the worsening conditions as proof that their political enemies are still a threat? Thank you.
I may ask, I think it depends how we define competent. I mean, for example, if we define competent in my framework in terms of effective crisis management, somebody would be competent, would follow, I mean, all these steps which I've elaborated. If we talk about the self-definition, I think the self-definition of a populist, I mean, they call themselves the superhero, but I mean, we need to really define what you mean by competent. I mean, do you mean competent? Okay, if somebody's competent, who speaks like who tries to be a representative of the common people, or do you somebody's competent who is a technocrat? And I think the populist, in this sense, there's definitely. I mean,
yeah.
I mean, give me a definition of competence.
Yeah. So for competence is a discourse as well as it is an action. I mean, these discourse of competence about getting things done doesn't exactly require specific actions, but rather it just needs to convince the electorate that these people are able to act. So I mean that's how I envision competence in this sense, is more of a discourse rather than an actual specific set of actions.
Okay, and can you remind me what's the link between that to, let's say, effective crisis management or yeah.
Yeah, forgive me if I wasn't clear. It's late over here, but the link is that they are presenting, the populists are presenting themselves as competent leaders. Whether or not that's actually true is immaterial right now, but that's how they present themselves. And yet you see worsening conditions among their supporters, rising death rates, rising hospitalization rates, and a general chaos as the pandemic unfolds. So the question is, how does this these conditions affect the perception of the populist leader as a competent figure?
I mean, that's interesting. I mean, I would say this further. I mean, I've tried to link this to polarization. So I think in a very polarized society, it is likely that core supporters don't see the incompetence because they strongly believe in the leader's cues. On the other hand, I think those who are in the opposite camp, of course, they probably see the populist leader as more incompetent than before. But in general, I think also to put this in a more broader perspective. I mean, okay, the populist self-definition is this definition of a very competent, charismatic leader. But again, a crisis such as COVID-19, which is also called a transboundary crisis, or a crisis that doesn't know any borders, or a crisis where there is a lot of uncertainty. I mean, this again features a contradiction to this populist self-definition, because the populist likes to define him or herself as somebody who has everything under control, who knows what he or she is doing, who has some God-given qualities, if we take even some authors. And if you compare this to like a situation where we don't know what happens tomorrow, where a situation where this crisis is unfolding quickly and without precedent and without us knowing what will be tomorrow. I think this will be, and in such a situation, because the populist leadership style is not a leadership style of a lot of accountability between different levels, for example. In such a situation, I think this shows just the inherent contradiction between the perceived or self-proclaimed competence and the conditions on the ground. And because the conditions on the ground are counter to what the populist wants to be. And this might, to bring back to Paul's question, this might then entice the populist to find new enemies. And one of these more enemies might be science. And I mean, we have not seen, I mean, it's unseen that, so for example, scientists have received death threats. And this doesn't happen only in the US, it happens in Germany, it happens in France, it happens in other countries as well. And this is also the sign that and maybe in such a situation they have to really reinvent the enemy. And one enemy might be science.
Okay, Daniel, we have Kofi. Please go ahead.
Hi, Daniel. I wanted to know, is it possible to see again I think it was the second to last slide, the one that showed the infection rate per 100,000 people?
I need to share it again, sure. Yeah.
Yeah,
And
so
what we-
this number 420, so that's the pure number per 100,000 that we would expect a Bolsonaro supporter to get, or is that
No,
420
we
more?
would expect. No, we would expect. I mean, this is the independent variable is the municipal level vote share for Bolsonaro. Okay, and so we would expect that a 10-point increase in this vote share. Let's say if the vote share goes from 30 to 40%, we would see an additional, for every 10%, an additional 420 new cases.
Okay, so it's every 10%. So then 20%, for example, would be 840 more.
Exactly, and this
Okay.
is as of December 2020. So that's when we took the survey. So right now, if our model still holds, the numbers would probably be much higher, because we have gone through 2 more waves by now.
Okay, thank you.
And the same way the death rates also means that, for example, if there's a 20-point gap, we would expect 14-point difference. If there's a 30% gap, 21-point difference in the number of deaths.
Thank you very much, Kofi. Jama, please go ahead.
Thank you so much, Dr. Daniel. Always great to listen to you. So I have, I think, 2-3 questions. The first is, given the context and the timing of your study, have you considered or accounted for the degree or the extent to which the people in Brazil relate science to elites? For example, and that's related, I think, why populists are anti-scientists. Why are they anti-science? So do you have any question or any survey question that's related to that addresses if people connect science to elites there? And I think when we think why are they doing this, for example, if you follow the last interview that Donald Trump, I think it was the last interview, he shifted his whole attitude toward COVID-19 and COVID vaccination. So are they doing that strategically, that if it works for them in the polls or the number of the people there, as for example, your study is that the people are listening the populists. Can we say the populist leaders themselves are kind of thinking about where the people are? And if they think the people are anti-elitist or anti-science, I myself be against maybe against the science, or may tell or kind of focus on the discourse that's against us. For example, if you look at Tunisia, which is led by kind of, we can say, populist leader, if you look at the stringency index, Oxford Stringency Index, the policies or the measures the government did, it was high, almost lockdown is social distance and everything. And the leader there, as a populist, didn't say anything about that. The stringency there was high, and the populist leader, Kai Said, was okay with that. So can we say it is not more of a built-in psychological tendency in populist leaders to reject the science, but it's more like a strategic kind of move that when it works for them, they may refuse or may reject the science and what the scientists are saying. Thank you so much, Professor.
Okay, let me just answer the first question about I would just go back to my slideshow for a sec, okay? I mean, what we asked is respondents predicted, no, that's not this one, predicted. Respondents predicted belief in science. I mean, it's a general question. And what would we try to find out is if people believe in Bolsonaro, trust less. So I think that's a clear connection between independent and dependent variable. But the questions we ask is everybody, how much do you believe in science? And then there was a scale from 0 to 10. And then your second question, I mean, is the, and I would say it's a reinforcing relationship. The second question is basically, is the populist leader just saying things because his supporter or his or her supporters wants him to say the things? Or is he generally pushing the supporters in a certain direction? And I think it's a reinforcing relationship. I think it's both. But nevertheless, if we believe this idea of polarization, that there's still a top-down component, it means the leader gives cues and follow, and people follow these cues. And so in this, in such a scenario, it still matters what the president says. The president is the figurehead, the president is the charismatic leader the supporters look up to. So it matters what the president says. It matters for the supporters, but it also matters for the general population, but especially for the supporters. So I would say this general framework which I built or which I took from the literature, that leaders are central to further pushing this type of polarization and even rendering societies more polarized. I think leaders definitely play a role in that, and leaders definitely play a role in shaping individuals' behaviors. Having said this, there's probably a feedback loop. That's it.
Thank you very much, Daniel. I would like just to take the opportunity, a few minutes, to ask you a few questions from our online followers. The first one is, do you think that populist anti-scientism is partially explained by growing resentment vis-a-vis of scientists and science instrumentalization? This is more like a more general question. Do you think does it have something to do with the instrumentalization of science, the skepticism?
I would say indirectly. Why? Because I mean, trusts. Probably one prerequisite for populists to have success is there must be low trust in traditional elites. And I think scientists are part of these traditional elites. So in a situation where there's low trust against elites in general, there's potentially also less trust against scientists. Because in one way or another, scientists are part of the elite.
Okay, thank you, Daniel. I have another question from our online followers, which is in Arabic. I will try to translate it. It's also like a general question. In overall, do you think that populism or populist discourse was, in general, more positive thing or negative thing when it comes to dealing with the pandemic in general? Let's put aside.
That brings up my potentially my own ideological predispositions. In my opinion, populist discourse can never be a good thing. Because what's the inherent nature of populism is this division of the world in two camps. One is good and one is bad. And so I think this division can never be good for society. And so I think I also don't believe, there are some scholars, for example, Chantal Mouffe, who believe in a leftist democratic populism. I personally don't believe in it. I personally believe that, I focus in my research mainly on right-wing populism, but I also think left-wing populism. If you adhere to the notion of populism, that means to the notion that there is an enemy and there's a virtuous person. And if you artificially divide society in two camps, if it comes to pandemic response, if it comes to general policy, if it comes to democratic credentials, personally, I don't see any benefit in populism. And I think it's dangerous if we as academics state that yeah, some sorts of populists are worse than others. I mean, there probably are, but I think we shouldn't go that far in saying some forms of populists are actually good.
Thank you very much, Daniel. Any other questions? Okay, I will ask my questions. In fact, I was just wondering, what is the time frame in your analysis? Because you collected data on cases, on that, etc. What is the time frame? Because you know, it has been like for now. I think we reached the fourth wave. Do you think that the result of your analysis may change if we have longer or shorter time frame?
I mean, the time frame is, I can tell you exactly. We collected data in the second week of December 2020.
Okay.
So this is the time frame for the, and the day we stopped data collection for the survey. It's the day we used as a cutoff date for the data on infection and death rates, which is, by the way, daily updated by Statistics Brazil. So.
Thank you very much.
And,
okay.
And Karim, wait. I think the second question, I mean, if the theoretical postulation or if the idea I proposed is valid, there shouldn't be any differences now. Okay. I mean, that the general finding should still hold.
Okay. Thank you very much. Ammar, you have questions and comments? Please go ahead.
If you want to continue, if you have any other questions, and then I can just ask my question, and then we can wrap up.
In fact, I have another one, which is more about the theoretical assumptions behind your hypothesis. You think there is a relationship between the kind of government, a populist government in place, and the level of populist attitude in society that imply some kind of belief toward science. My question is as follows. Do you think in Brazil, during the pandemic, if they did have a non-populist president, the attitude of people towards science will be different?
Okay, first part, just to make it very clear, the assumption is that these cues from a populist should have a strong impact, in particular in a polarized society. I mean, this polarized society is a very important aspect of the theory. And so the question is, if there was so basically the question is a counterfactual. You asked the question, so is assuming Brazil would be governed by a non-populist.
Yes, exactly, that was.
I would say that, well, you know, that I would rephrase it. I mean, I would say yes, but there's also, I mean, if we look at this reinforcing relationship, there's also, I mean, do you also expect that the polarization would be lower?
That is a good
because, I mean, if you have a non-populist leader, I mean, it would be an interesting case, the same type of polarization. And there would just be somebody else in power. But let's assume the populist has the same amount of support or very similar amount of support, and the leaders listen to him, like what we have in Trump, I mean, the US right now. There's no change between Trump and between Biden and Trump in the type of polarization and the type of behavior people behaving. So I would say the real measure, and it's a good question, is potentially the level of I mean, I frame it with but you know, the leader, that can be the leader of the country, but can also be the leader of the party people listen to. So I would say if we have just a different leader, but the same support patterns, very little will change. If we have a different leader and lower polarization, things will change.
Thank you very much.
Because there's a broader base of the population who are tuned to, let's say, to mainstream information, to science, to horizontal decision making, for example. But it's an interesting question.
Thank you, Daniel. That proves that I had a good professor, which is you, by the way. Ammar, please go ahead.
Yeah, once again, I want to thank you so much for this fascinating lecture. I had a question that may seem kind of out of place because it's about the non-populist or the anti-populist, we might call them, the people who don't like the populist leaders. Might, a part of the effect that we're seeing be also their reaction to the populist. Right? I don't like this leader. I don't like Bolsonaro. And he's saying, not to trust science. So I'm going to trust science even more. I'm going to wear my mask everywhere. So that kind of polarization could also lead to some individuals, right, actually complying more often, those who oppose the populist leader. Do you think there's some possibility of that? I don't personally know the case all that well, right? So, but do you think that there was also this kind of pro-science reaction from those opposed to the populist leader?
It's again a very good question. To be honest, I don't have the answer, but my theoretical framework assumes that it has a negative. I don't express myself overtly what happens to those who oppose it, but of course it might be that they believe it even more, because you're either with him or against him, and if you're against him, I'm not sure if I can go as far, and because I'm against him I would even stick more to, let's say, COVID mitigating measures like wearing masks. I don't know, but I think that would be a great study for an experiment. How people in a polarized society like the US or Brazil, if there's some cues also, I would say it's possible. Intuitively, I wouldn't say it's very strong.
Yeah.
It's probably stronger for some components than others, but I would say it's definitely possible. And I think it would be a really nice study to look at it, whether in a polarized society, actually, if the populist is against something, more generally, it can be COVID or something else, others who are against the populist are just even more strongly in favor of it. And I think that would be a very, very interesting piece of research, which, as far as I know, the literature hasn't been done a lot.
Well, you publish so often, I'm pretty sure it'll be done by this evening.
Tomorrow.
At least the design will be set.
I send you the article tomorrow.
Thank you.
So that was my question. Are there any other questions, Abdulkarim?
Yes, we have one more question. Please go ahead.
So I wanted to ask, is there any distinction that you'd like to make between, I know in the Brazil case that you look into, but is there any distinction that you want to make between populists in power and populists not in power? So I'm thinking about cases also in South Asia, like Imran Khan in Pakistan, a populist leader was pro-vaccine, Narendra Modi was sort of pro-vaccine, even Boris Johnson took the vaccine, AstraZeneca. I was wondering whether this idea that in the end sort of the body counts, a populist leader in power should act differently than a populist leader not in power, like he'd be more pro-vaccine, because in the end, no matter who you are, the body counts really, really should turn your opinion once you're in power.
Oh, that's a great question. But it's basically the question if populists moderate when they're in power. And I would say some do, some don't.
Do you want to add
Sorry,
something?
it was a quick answer, but
Okay.
that's the answer.
Okay, thank you very much, Daniel. Any more questions? I think I can hand over to Ammar to conclude, please.
All right. Thank you all very much for a fascinating second day. And thank you, Dr. Stockemer, for an absolutely wonderful lecture. I think we all learned a lot. And I think the potential research questions are bubbling, which is always a great sign after a lecture. So thank you so much for joining us again. And hopefully in the future, we'll be able to have you here in person.
Thank you so much. And yeah, thanks to everyone. Thanks. And really enjoy the rest of the winter school, and I can hopefully come in, as I said, at some point and visit you in Doha. Thanks again for having me, and I think it's late for you, so have a nice evening. Enjoy it if you can go out a little bit. If you can go to the restaurant, enjoy it, and yeah, enjoy the rest of the winter school, and also thanks so much for the organizers. I think it's a great initiative to have this. It's also a great initiative for students from all over the globe. I mean, I looked a little bit at your brochure you sent. So yeah, and if anybody wants to stay in touch, please do contact me, and we're always happy to exchange views and answer questions and help you if I can. So thanks again, and bye-bye.
Thank you very much. That wraps up our second day of the winter school. I hope you'll all join us back here tomorrow. Thank you. Have a wonderful evening.